The following program is sponsored by El Camino Hospital in partnership with Blue Orchid Press.
Did you know that about 1/2 of all adults in the U.S. are considered overweight or obese? If this is something you're concerned about, it's time to do something about it. Don't be a statistic. This year, make a commitment to take charge of your health. Hi, I'm Nurse Barb with your Daily Dose. I'm at El Camino Hospital, where today we're going to tackle how to lose weight. I'll show you some simple steps you can take to avoid big problems like diabetes, heart disease, and other serious conditions. First, let's start with one of my favorite topics, good food. I'm here at the demonstration kitchen at El Camino Hospital with one of my favorite chefs, Chef Jacques. Thank you so much. You're going to teach me how to make this delicious chicken recipe, right?
That's correct.
When I look at all of these great ingredients, it looks like something you might find on a pizza, so even kids are going to enjoy this.
You can actually put all this on a pizza. That would be great. We use a lot of fresh herbs here. We try to use a lot of fresh vegetables and fruits and incorporate into our meals, especially for the patients. Since a lot of sodium and pepper is not used, we have to complement it or substitute it with fresh herbs.
Oh, so this dinner could be ready in about 10 minutes.
About 10 minutes. The biggest part is having all your ingredients chopped and diced and ready to go. I truly would recommend meeting with a dietitian for any type of diet before going on a diet because they have the education and they can tell you exactly where you need to be and where you have to go to make yourself better.
Wow, that looks great. Wow, thanks, Chef.
You're welcome.
All right, where's the fork? Is healthy eating enough to keep your waistline down? The answer may surprise you.
0 calorie does not mean 0 risk. People who eat diet foods actually are shown to have exactly the same amount of diseases, same metabolic syndrome, same diabetes. When the person eats or drinks diet drinks, what their brain thinks, I got the sweetness, where is my calorie? So the person actually eats more. Metabolic syndrome is a condition that precedes diabetes, and it's a combination of diseases, including high blood pressure, high triglycerides, it's a type of a cholesterol, low good cholesterol, otherwise known as HDL, abdominal obesity, which is apple shape of the obesity, and prediabetes. If you take the population in the United States at the beginning of the 20th century, we probably had less than 1% of population that had metabolic syndrome. Today we have 25%. Now why is this happening? Again, it's because of our eating habits. It's the amount of sugar that we're eating. Imagine at the beginning of the century, an average American had about 5 pounds of sugar. Today we have an average American consuming 170 pounds of sugar per year.
Does the idea of losing 30 or even 20 pounds overwhelm you? You're not alone. Guess what? The amount that you actually need to lose may be less than you think.
It's very well proven now, and there is a lot of data we have suggesting only thinking about 10% of the weight loss. So a person should take baby steps towards their weight loss. So 10% of the weight loss is proven to give medical benefits to the patient's disease conditions. For example, the diabetes would improve tremendously, hypertension gets better, and many of these patients I see day in day out in my office that they can really reduce their medications and get better reducing their risk factor for the heart disease.
So start the new year right by taking these small steps. Learn if you have metabolic syndrome. Eat a nutritious, healthy diet. Exercise and actively manage your weight. It will be the best New Year's present you can give to yourself and your family. To help you get started, join El Camino Hospital's Health Perks program and you will get a set of nutritionally balanced and delicious recipes. Your membership is free. Just use Nurse Barb as the special code when you sign up. For everyone who joins by January 31st, you'll be entered to win a yummy treat, a special cooking class and dinner with Chef Jacques and me. And remember, always get the information you need to make the best decisions for your health and the health of your family. I'm Nurse Barb, and this is your Daily Dose.